Going into the summer months, oftentimes there's much more sunlight. In terms of protecting yourself in regards to sunscreen, protecting your skin, recommendations, thoughts on that?
The sun is stronger now than it's ever been. There's no question about that. Studies have definitely demonstrated that, and thus protection from the sun is important. Sunscreen, at a minimum, probably you should have a 30, if not a 50 or a 60, and particularly on parts of the body that don't see a lot of sun or are quite sensitive. Face, in particular, at this point, is something you would want to have that higher level of sun protection on. The other thing is, physical blockage is important. Hats. And it sounds very simple and easy, but super effective from getting that extra bit of damage to your skin. The sun is so potent these days that damage can occur sometimes as little as 20 to 30 minutes. And that is the part we really worry about. Physicians at various levels, see patients who have experienced too much recurrent skin damage from the sun, and that's the point where we end up having to say, okay, we may need to make a change here, or you may need to have higher levels of care.
How often does one need to apply sunscreen? So if it's the summer months and you're running through sprinklers or in the pool, running around that you're sweating, is there a recommended amount in terms of applying it?
The recommendations at the beginning of the day is put it on and allow it to at least soak in and dry. Some people try to just put it on as they're getting out in the middle of the sun, and it isn't the most effective to do that. Put it on and allow it a little bit to dry, and then go out and be active. Every time you go out into probably a hydrating environment, whether it is a sprinkler or a hose or a pool or anything else, afterwards drying off and reapplying is important, so you're fairly consistent with that. If you're sweating a lot or you're participating in an activity that just ends up coating you with a lot of perspiration, then yes, I think you need to probably have a quick rinse off and then reapply the sunscreen at that point.
For those that obviously have applied sunscreen but still end up with a sunburn, what are recommendations for treatment or aftercare of a sunburn?
Things that are soothing. Obviously, getting out of the sun is super important. Topical agents that tend to soothe are anything that would help the skin and burn. Sometimes having an oral systemic anti-inflammatory will definitely help. Less so Tylenol, more so in the ibuprofen range of products. Aleve, naproxen, all of those will help a little bit relieve that. Even an aspirin will definitely make a change in your sensation.
Safe to say that everyone's had a sunburn. What are things to watch for when you should be concerned regarding the severity of the burn?
I think everybody will probably experience a sunburn in their lifetime. The issue is the recurrence of them. And you're right, the severity, burns, a burn is a burn. There's, multiple grades of burns, and we know the three basic levels, the first, the second, and the third degree burn. God forbid you should get a third degree burn, which is black and charred and everything else. The first degree is that redness that you tend to have. If you start getting in the blistering, though, you're in the second degree, and that's actually quite serious. We worry about people who get second degree burns, and definitely if you start blistering, you will have gone way too long. You need to get away from the heat, the radiation, the sun itself, and get out so that you stop doing damage to the skin.
And then in terms of the long-term effect, so you've had sunburns multiple times, or maybe you've never had sunburn and you're just a fair-skinned individual. What are things we often need to watch for then on the skin to notice changes? This
is a multifactorial question. There's no doubt about that. It puts into context not only the severity of the burns, but the surface that is burned on, meaning your skin type. If you have a very pale skin type, and there's different ranges, there's a particular scale for it. If you're in the very light side of the scale, you're at higher risk. There's no question about that. And that you're at the darker end of the scale, you're at less of a risk. Although we know that people at the darker end of the scale tend to still have lesions that are concerning as much as the light. Frequency, your particular skin color, and the intensity of the burns that you have been having are all factors that factor into things that we would be concerned about.
And then when you're following up with your family doctor, let's say about something that might be concerning lesion-wise or a mole on the skin, is there an acronym that people should be using to reference when to seek out medical attention?
Well, there's everybody uses the ABCDE criteria. We look at lesions or particular skin lesions that are concerning for asymmetry, irregular borders, multiple colors, a diameter of greater than 7 millimeters. Some people say elevation and or everything else that goes along with it, the other subtle characteristics of the lesions. You want to have somebody with a little bit of experience in looking at skin lesions who recognize something that might be a little more concerning than the average versus kind of being more of a reassuring type lesion that there isn't anything going on.
And how often should people be getting skin checks then?
It, again, depends a little bit on your family history, your skin color, your discolorations, your radiation exposure, previous cancer. For some, it's as little as every 6 months to a year. For some, it's as often as 5 years. I think those factors all play into that decision.
And then for your skin checks, is that something your family doctor can do? Do you need to see a dermatologist?
You do not need to see a dermatologist for every skin check. I don't think that's absolutely necessary. Again, it comes down to complexity with history. You know, if you have a lot of history of cancer, skin cancer in your family, and you're very fair skin, and you've had a lot of sun exposure, that might justify the dermatologist. If you are less so and you're at lower risk in many of these categories, then a family doctor who has experience in dealing with skin cancers might be more appropriate.